Hi, I'm Dr. Philip McMillan. Thank you for joining me. And I'm taking on a relatively controversial topic because I think it needs to be discussed. And when we have situations that are affecting, especially stars, where it impacts the whole life, not just their life, but also the public who love the singing. Celine Dion is no longer performing because of stiff person syndrome. And my role here is to say that from a scientific, medical, clinical point of view, I think that we first have to acknowledge the potential links. Without an acknowledgement, there is no opportunity for mitigation. And that's where largely I'm starting from. Spike autoimmunity, I think, is a critical factor that we have to do in terms of understanding what is going on. Now, I suspect that many people will say they disagree. This is a long term illness. But by the end of the presentation, for people who are with me, you will understand why I'm putting it in this way and why, if you know Celine Dion, you probably should ask her to get in contact with me because I suspect that there may be alternative routes to try and see if we can get her better. If this has not been included in the differential, I suspect that they don't have a broad enough thinking with regards to addressing the problems that are affecting her. So let's just start, and I'll take you through. If you're with me, you're going to see the first part for people who have registered for the webinar. You will then go through to the end where I'll explain the approach that I take clinically. But let's take you through some of the science and why I think that this is such an important piece of information, as well as her timeline. So let's start with this presentation. There are a number of slides, and I'll take you through them step by step. So if Celine hasn't thought this, I'm not sure if I can help her. Because if she has been through where she is and she hasn't been significantly affected, I'm not talking about minor symptoms, but symptoms that could be life changing in terms of her performances. If she has not asked that question, then in reality, there is nothing I can do because that's therefore becoming ideological. Because anyone who says that it's not possible, that's not scientific. Of course, it's possible. Whether or not it's probable or how it could be relevant, that's where the history comes in. And so that's a critical question because this is not just about her, this is about your family members who have unusual patterns of disease that they don't understand and they have not even thought of the possibility. If you haven't thought of the possibility, then there is what I usually describe: there is an elephant in the room. We need to address it. It needs to be understood, and we need to have mechanisms that we can handle it from. So, when we think about COVID, and people describe this as long COVID, I think that we're going to have to change the name because it's causing confusion. Some people describe long COVID as long vaccine. Some people describe it that they don't think it exists. A lot of clinical people don't think it exists. But based on the research, this is one heck of a disease. It is very real and very, very debilitating. And I don't look at it though as a specific disease. And so you have to understand this image here. People have prior immune activation. Now, this can be subclinical. And so they're feeling fine, no problems. Then they could get a COVID infection, and you end up with this huge flare up of disease. What we're trying to understand from a scientific point of view is why doesn't it go back in the box even after the infection has resolved? Or this also happens with regards to vaccination, a really important point, because how can we have a similar disease pattern that comes from two separate things? Very important scientific questions that we need to be able to answer. But it's important to remember, in terms of my approach to looking at this, if there is no prior subclinical inflammation, your risk of this is pretty low. And so that's the point that I would generally start from. And when I look at this long haul disease, as I said, it could be from multiple sources. I tend to not completely exclude severe organ damage because that's just damage to the heart, the kidneys, and the lungs. You can have long COVID from mild infection, which is usually tied to Epstein-Barr reactivation, microclots, gut immunity is part of it, epipharyngeal inflammation is another. And then you have as well this long haul disease that a lot of the public would argue this is everything. No, it isn't. There is definitely this that exists even prior to the rollout of vaccines. Yes, we can have the two coming together, and that is extremely difficult to separate out. Now, it's important to remember that some people actually get improvement of symptoms after they've been vaccinated. That in itself suggests that it is an immune mediated mechanism, and so we really need to understand it. The reason why I think that it is inappropriate, if anybody says that their symptoms, especially long term symptoms, can't be related to it, is because you don't understand how significant the range of symptoms are. This was from a paper from about 2022, 50 long term effects, of which fatigue and headaches are two of the most common ones. Now, in the context of Celine Dion, I would suspect, I would bet that she also has some degree of headaches. She probably has some brain fog, but she definitely has the muscle spasms and so on, which I'll come into in some degree of detail. But this is part of the question, is that this is likely to be connected to what had happened before. And I'll take you through the timeline. Now, many people say that she has had this illness for many, many years. If she did, it wasn't very obvious. And that's part of what I was looking at. So I spent some time looking through her documentary, looking at some of the shows. So I really sat down and thought about this from a clinical point of view. And this is the timeline of observed, published article related symptoms that she had prior to, say, 2019. And in 2012, she had some viral illness that caused weakness of her vocal cords. I think it had interfered with a show. In 2014, she had postponed a number of Las Vegas shows because she had a throat infection. Now, that straight away indicates to me that she has recurrent viral illnesses, which suggests interferon sensitivity, but I'll come to that later. Then she took a break from performances in 2016 because of vocal cords and also following the death of her husband. She needed a short break from her tour early in 2016. And then in 2018, she had a middle ear condition that required a procedure. And so this is somebody who performs quite often. And so if she cancels a show, it's a big deal. And doing a performance takes a lot of energy, a lot of planning. And so I can look at the trajectory of how she was operating and realize that she was okay, even if she had some minor symptoms, they weren't significant enough to stop her from being able to do her performances. Now, I'm going to show you an article from The Sun that I think is the red flag. This was around 2019 because this article was actually published on the 29th of January 2021. And this is in The Sun, and they were talking about her weight loss. How did she lose weight? So this they had as before, this is after. Now, there's a difference between someone who is slim and someone who looks unwell with regards to their weight loss. This does not look well. So I know that around 2019 and in that period of time, apparently she was doing a lot of ballet and she was trying to lose some weight and get fitter. Now, I will tell you this much, that many people underestimate what can happen with regards to their gut when they make significant changes to their routine and their diet. And I think a big part of this is that it's quite possible that this was the critical subclinical inflammatory point. Because I know when I look at that image that that's representative of somebody who is not actually that well around 2019. This picture here, she looks fine. This does not look right. So that's where people are talking about that this has been going on for some time. But I don't think this is SPS because she had been performing still. And believe me, if you get a spasm with SPS, you can't perform. So there couldn't have been very significant abnormalities at that point. So let's step on. What really is stiff person syndrome? And this is just a basic summary. The primary problem is that the person has increased stiffness of their muscles and spasms. They're unpredictable. They can come out at any time, can be triggered by even noise, infection. It's very difficult to manage. Critically, it's an autoimmune disease. And that's what I've been focused on around COVID since 2020. Fits perfectly. The main target here is an enzyme, glutamic acid decarboxylase. We call it GAD. And this enzyme makes an inhibitory neurotransmitter called GABA. And I'll give you an idea as to how the neurology works around it. And GAD is also connected with the beta islet cells in the pancreas. So, of course, there is an association with type 1 diabetes. Some people may just have type 1 diabetes from these autoantibodies targeting GAD. So, other people may have a combination of things like SPS and diabetes. But it's the autoantibodies primarily, but not only to GAD, but I have focused on GAD from the purpose of simplicity. Now, this is an example of how the neurology works. Now, you have all these neurons, and you can imagine that these here in red are your excitatory neurons. Say, for instance, these are the ones that would go from your brain and stimulate the muscles, these big ones here. And so in between them, they have green, and green represents inhibitory interneurons. Because what the body is trying to do is just because a signal is coming doesn't mean that it is time to fire. And so the body uses this balance between inhibition and excitation to control everything that we do. So, just as important as these firing are also neurons that inhibit. That's where the GABA comes in. GABA is part of that inhibitory mechanism that helps to balance the nervous system. So, this is where we understand the basics with regards to SPS. And this is just how the body generally works. I use this image here to show this is a shoulder muscle, the deltoid. This here is the triceps and this biceps and the triceps. And if you think about it, if you only had biceps and you could only flex your elbow, you couldn't work because you need to extend it. So everything in the body is about balance. Wherever you have an activator, you have a counteracting effect that inhibits it because otherwise you would have too much activation. And so GABA is related to relaxation of muscles. And any drug that increases GABA will tend to reduce muscle spasm. So this is primarily how we would approach from a pharmaceutical point of view, how you would reduce the symptoms by using drugs that increase GABA in the brain and even in peripherally in the gut, so that it would have an impact on it. Now you have to remember, if GABA, say for instance, is too much, you would then have issues like epilepsy or Huntington's disease. This is where people have too much GABA. So everything is about very tight balance in the body and allowing it to work in an effective way. Now, here is an example of the pathophysiology, and this is in SPS again. I've got here one side of a neuron. So this would represent an inhibitory interneuron. You would have glutamate, which is converted by GAD here into GABA. The GABA is then packaged, and then when there's an electrical stimulus, it's released, and it then inhibits this part of the other neuron. That's how the synapses work. What I've got here is that I've got this represents SPS. So here you've got normal amounts of glutamate, but antibodies or autoantibodies target GAD, they block it. And so instead of having multiple GABA, you have much less in these vesicles. And so what you end up here in the synapses is significantly less inhibition on these postsynaptic neurons. And what it means is that if you had excessive firing, it technically causes the other neurons to fire more because there is not a counteracting of this inhibition. That's the basic principle with regards to SPS. And this is why you have increased stiffness, because you don't have enough inhibition. Simple as that. And so when you're thinking about addressing that, you have to first address the autoimmunity and hope that the body builds up its normal GAD levels and potentially get GABA from other sources. That's the general thought. But here is why I think this is very important. And you look at this here. This is an image showing the gut-brain axis. So you have the brain up here. It has its neurons, especially the vagus nerve that goes down and supplies large portions of the intestines. And this is just a picture of how you have this interaction with the bits of the vagus nerve coming all the way down to the lining of the intestine. The point being, the weight loss that she had was likely to have caused inflammation. The inflammation is then likely to have potentially unmasked the risk for autoimmunity. That autoimmunity was then triggered after the COVID pandemic. And so this here is another example of just how complex this intestinal nervous system is. Looking at this here, so this represents the inside of the intestine. These are the lining cells, and this is showing all of these neurons and interneurons. So it's important to know that the GAD and the GABA inhibitory neurons are also present in the intestine. And so this is why it is so critical to understand that if you are having neurological symptoms, very often the link is with the gut because there is a very strong gut brain axis. And that's part of why I think there are ways to manage what's happening with Celine Dion. So let me take you through my timeline of what I think happened. So let's follow this. As I told you, in 2019, she looked unwell. And I think at that point, whatever was going on was the subclinical inflammation. So even though she was still able to function, even though she was still able to perform, there was subclinical inflammation. Now, watch what happens in terms of the timeline. So in March 8th, 2020, that was Celine's last full show. Okay, remember, she's already slim, she's dancing, she's probably on a special diet. Yet, by the 11th of March 2020, the pandemic is declared across the world. So on the 8th of March, she's still performing, and this was in New Jersey, Newark. She has another show on the, no, actually, I'm not sure if this is New Jersey, but on the 12th of March, 4 days later, she has another show. In that show, she cuts it short because she had severe cold symptoms. That was in Newark, New Jersey. So look at the timeline. The pandemic was declared on the 11th of March. On the 12th of March, she had a cold that was significant enough that she had to cut her show short. In late 2020, that was the first documented symptoms of these muscle spasms that went on to become SPS. In May 2021, she was actively promoting COVID vaccines. And now it wouldn't be surprising if she had severe symptoms at that point. She would be very happy about the benefit here. However, by October 2021, the shows were canceled. She could do no further performances. And by December 2022, there's an official diagnosis of SPS. When I look at that timeline, that for me fits perfectly with spike autoimmunity. Now remember, spike autoimmunity doesn't matter the source of the spike protein, infection or otherwise, can drive immune responses. And if you are part of the webinar, you will see me explain that in a little bit more detail. But that is the critical piece of the puzzle. Now, it's important to acknowledge that when this came up, and I'm going to show you the actual article. This is the actual article that was from AFP Fact Check. And in this article here, so this was done in 2022. And they made it clear that the diagnosis was unrelated to the vaccine. Now, why would they do that? Well, it's because it was all over social media. You can see here, this is what caught a lot of attention, and this is what they were trying to deal with. You will never guess what's in the documents. It's when the documents were released. Right here in the middle is one of the potential side effects here. And so they were trying to manage that by saying there is no evidence that the two are connected. And I completely understand them saying that, but I don't disagree that they should have said that. What you can say is that you don't know for certain. It is possible, can't be completely excluded, but at the moment you don't have a direct link. That would have probably been more accurate. However, based on the timeline that I had just said before, I would suspect that this is very relevant. And that's my point, is that if at this stage we have a situation where Celine is not asking this question, I don't know if, based on my analysis, I can help, because the reality, she would not be open to it, because ideologically she'd say that's not possible. From an autoimmune perspective, it makes perfect sense. If you have subclinical inflammation, then absolutely anything that activates that could bring on symptoms. And that's essentially the focus of what I'll be doing now. And for those people who had registered for the webinar, we'll take you through in a little bit more detail as to how and why this works. But for everyone else, please look out for links to the full webinar, and you can argue as to whether or not we are on track when I speak about spike autoimmunity. My advice, if you know Celine, you never know, some of my audience may know it, what have you got to lose? There's nothing that you can lose by asking me what I think could and should be done. That's up to you. And for the webinar guests, please stay with me. For everyone else, thank you for joining me, and we'll speak again soon.